Have you ever thought that no pain means no problem? Well, think again. Many seniors are shocked to discover they had cancer silently growing for months or even years without a single ounce of pain. And by the time symptoms finally appear, it's often too late. Today, we'll uncover 5 silent, pain-free signs that cancer might be growing inside your body right now. You don't want to miss this, especially if you're over 60. Welcome to Elderly Sage, where we uncover life-saving health tips and advice specifically for older adults. If you care about your future and your family, then stay with us until the end of this video. One of the signs we reveal today might just save your life. Let's begin. Sign 1. Unexplained weight loss. Have you lost weight without trying? Not dieting, not exercising more, but suddenly shedding pounds? That's not a gift. It could be a silent red flag. Cancer cells are greedy. They consume the body's nutrients rapidly to fuel their own growth, and they often mess with your metabolism. For seniors, losing 10 pounds or more without explanation, especially over just a few weeks or months, should be a major concern. This is common in cancers of the pancreas, stomach, esophagus, or lungs. And no, you don't have to feel any pain while it's happening. That's the danger. Quick tip: keep a monthly log of your weight. If you notice a drop and you haven't changed your habits, it's time to speak to your doctor. Sign 2. Constant fatigue. Not just tired, we're talking about a fatigue so deep that sleep doesn't fix it. A kind of exhaustion that lingers day after day, no matter how much you rest. This is because some cancers release chemicals that change the way your body produces energy. Others cause slow internal bleeding, leading to anemia, making you weak and drained without any clear reason. Fatigue is one of the most overlooked early signs of cancer. Why? Because we assume it's just age. Remember, being older does not mean you should feel like you've been hit by a truck every morning. That's not normal aging. That's a warning sign. Sign 3. Changes in bowel habits. Let's talk honestly. If your bathroom habits have changed and those changes stick around for more than a few days, it's not something to ignore, especially if you're over 60. We're talking about diarrhea or constipation that's new for you. Narrow, pencil-thin stools, a feeling like you haven't emptied your bowels fully, or blood, bright red or dark, on toilet paper or in the bowl. Colorectal cancer, one of the most common and deadly cancers in seniors, often begins with no pain. Just these subtle shifts in digestion. Don't wait for pain. Look for patterns. Trust your gut literally. Sign 4. Persistent cough or voice change. A cough that won't go away after 3 weeks. A voice that suddenly sounds raspy. A wheeze that wasn't there before. These can all be early signs of lung or throat cancer. You might not feel any chest pain. No fever, no shortness of breath, just a nagging cough that keeps coming back. Here's the scary part. This is one of the most misdiagnosed symptoms in seniors. It's often mistaken for allergies or just getting older. And by the time it's investigated, it's stage 3 or 4. If you've been coughing every morning for weeks, see your doctor. Not later. Now. Sign 5. Skin changes. Did you know skin cancer is the most common form of cancer and one of the most survivable if caught early? Yet many seniors ignore changes on their skin because they're painless. Look out for new growth soft spots that change shape, color, or size, moles with uneven edges or multiple colors, patches that itch, bleed, or don't heal. Melanoma can spread quietly through your body without causing pain until it's too late. Make it a habit to scan your skin every month. Use a mirror. Ask a partner or caregiver to check your back and scalp. There you have it. 5 signs your cancer might be growing without pain. Cancer doesn't always scream. Sometimes it whispers. And for seniors, those whispers often go unnoticed. But now that you know what to look for, you can act before it's too late. If any of these signs sound familiar, don't panic, but do take action. Call your doctor. Get checked. Early detection is your best chance. And if you found this video helpful, please like, subscribe, and share it with someone you care about. Because knowledge shared can be a life saved. Until next time, stay strong, stay informed, and stay wise.